Jagmeet, whenever you're ready.
Okay, thank you. We have heard this a number of times throughout the pandemic that our healthcare system is in trouble, but it's becoming very clear now that we are in a very serious crisis. And it is not good enough for premiers to start talking about creative solutions when their solution is to privatize our healthcare system. And what does that really mean? It means that if you've got money, you can pay to get care. And if you don't have money, you're not going to get the care that you need. We've seen this show before. We've seen other countries where the wealthy have the best care possible and everyone else has to struggle to get care. We don't want that here in Canada. We want a publicly funded healthcare system that's good for everyone, that's going to be there for everyone. And we also know that we've got a mixed system. Our public dollars, our taxpayer dollars, end up going into the pockets of rich corporations, enriching people instead of going to the care of our loved ones. And we can't allow that to happen. And why are we in this position? Well, one specific reason, one concrete reason why our healthcare system is being starved of funding is because the federal government hasn't stepped up and done its part. Premiers are starving our system of funding that it needs. Doug Ford is doing that here in Ontario and other provinces as well. But the Prime Minister, Justin Trudeau, has a responsibility to deal with this national crisis and has been absent. There have been demands to meet. The premiers have asked to meet with the Prime Minister and he has refused to meet. There have been demands to sit down and talk about what we can do for the future of healthcare in Canada. The Prime Minister has been absent. We are calling on the Prime Minister to step up and show leadership to defend our healthcare system. This is a dream that Canadians believed in, that our healthcare should be something that everyone can access no matter what you make, no matter what your job is, no matter what's in your bank account. Everyone should have access to the best care possible. And we believe in that. We want to defend that. And we've got a number of concrete ways that we can actually protect our healthcare system. We need to urgently act. So right now we're calling for 3 specific immediate steps to deal with this urgent crisis. We can, at the federal level, accelerate. We know there's a big shortage of healthcare workers, and we know that there's a lot of questions around how we can get the sufficient human resources, the people that we need in the healthcare system to actually provide the care that people need. So there's 3 things that we're calling for. 1, we need to accelerate the recognition of internationally trained healthcare workers. There are so many people in Canada that have international training that are not able to work in their fields. We need to accelerate the recognition of their talents and skills and their training so they can give back to Canada and do what they want to do what they love doing, and be able to provide that care and that human resource that we need here in Canada. In addition, there are so many Canadians or so many people that are in Canada that do not have immigration status, and that is the only barrier to them practicing in frontline healthcare. We met with nurses who have gone through the qualification process, who are qualified, have met the rigorous demands, and are able to work in Canada, but for the fact they don't have the immigration status that they need. That is something the federal government can deal with an accelerated path for healthcare workers to get immigration status so they can work here in Canada. And finally, in terms of immediate steps, we know that a lot of our seniors who need care are in hospitals, but who need to be in long-term care homes. But long-term care homes don't have sufficient beds, again, or human resources to deal or to be able to treat and care these patients, these seniors. So what we need to do is increase the number of long-term care workers so that we want to hire over 50,000 long-term care workers so that we can make sure that a senior isn't left in a hospital bed waiting for a space at a long-term care home. They can immediately get into the care that they need, which is a better fit for them and frees up beds in the emergency rooms and in hospitals to deal with the emergency cases that are now being put off or being delayed, or people having to wait so long before they receive care. And finally, and ultimately, what we need to do is to properly fund our healthcare system. And the federal government has to step up. Prime Minister Trudeau has to step up and meet with the premiers and lay out a course for properly funding and defending our public healthcare system where everyone can get the best care possible. We cannot allow premiers to talk the talk of Team Canada or throw around words about creative solutions when we know what they're going to do is put money in the pockets of the wealthy, and they're going to hurt Canadians who are not going to get the best care that they need. That's what we're here to talk about today. And I want you to know you can count on me and my team to continue to fight to make sure our healthcare system is public, that it's well funded, that it's there for you and your family, and it's not going to be a question about how much you make to determine the care that you get, but everyone in this country should get the best care possible. Donc aujourd'hui, je veux parler de ce qui se passe à travers le pays. Le fait que depuis longtemps, on a entendu des inquiétudes par rapport à notre système de santé. Pendant la pandémie, à plusieurs reprises, les travailleurs de santé ont soulevé des inquiétudes. Quand on a des problèmes, c'est difficile à répondre aux besoins des gens. Et maintenant, ce qui est clair, on est dans une crise dans notre système de santé. Et ce qu'on doit faire, c'est de répondre rapidement pour protéger notre système de santé publique. Parce qu'à ce moment, des premiers ministres des provinces essaient d'introduire la privatisation de notre système de santé. Et ça veut dire que si vous avez l'argent, vous pouvez acheter les services nécessaires. Et si vous n'avez pas l'argent, vous n'aurez pas à avoir accès aux services nécessaires. C'est un système qu'on a vu dans les autres pays. C'est un système qui enrichit les ultra riches, mais qui fait mal au monsieur, madame, tout le monde. C'est un système qu'on s'oppose parce qu'on veut avoir un système universel, public, entièrement public, qui est là pour vous et vos familles et qui ne dépend pas de combien d'argent vous avez dans votre poche, mais qui est basé sur le principe que tout le monde doit avoir accès aux meilleurs services possibles et ce qu'on va faire. Donc, on propose quelques éléments immédiats pour répondre à cette crise. 3 éléments spécifiquement, 3 étapes qu'on peut prendre maintenant. Un, c'est d'accélérer la reconnaissance des compétences internationales parce qu'on a plusieurs personnes au Canada qui ont les outils, la formation nécessaire pour travailler dans les soins de santé, mais leur compétence n'est pas, ce n'est pas quelque chose que le Canada reconnaît. Donc, on doit accélérer la reconnaissance de ces compétences. Deuxièmement, on a des travailleurs ici au Canada qui ont la compétence, qui sont qualifiés, mais la seule barrière, c'est leur statut d'immigration. Donc, on doit accélérer un processus pour avoir ces travailleurs, pour enlever cette barrière d'immigration, pour qu'ils puissent contribuer ici au Canada. Finalement, on doit embaucher plus de travailleurs dans les centres de longue durée, dans les soins de longue durée, parce qu'on a trop des aînés, de nos proches, qui sont dans les hôpitaux, qui doivent être dans les centres de soins de longue durée, mais à cause du manque de ressources humaines dans ces centres, ne peuvent y aller. Donc, on doit régler ce problème. Et finalement, et la grande solution, qui est la plus importante, c'est le fait qu'on doit financer notre système de santé. Et le Premier ministre refuse de rencontrer les premiers ministres des provinces pour parler des solutions pour notre soin de santé, spécifiquement la contribution fédérale. Parce que depuis des décennies, la contribution fédérale était diminuée. Les conservateurs et les libéraux ont diminué la contribution fédérale. Et c'est une partie de la raison pourquoi on est dans cette situation maintenant. Et c'est pourquoi on exige le Premier ministre Trudeau d'être là, de montrer le leadership et de bien financer notre soin de santé dans une manière durable pour le long terme, pour défendre un système de santé public et universel. Merci. Thank you. With that, I'm ready for any questions you might have.
So we will go ahead with questions. We will start on location, 1 question, 1 follow-up, and then we will go to Zoom. For those who are with us on Zoom, please use the raise hand function to ask your question. We will start on location. Nous allons commencer avec les questions sur place. Ensuite, on va aller sur Zoom. Pour les personnes sur Zoom, je vous invite d'utiliser la fonction lever la main pour poser votre question. So we will go ahead with the first question on location.
Good morning, Mr. Singh, Omni News. Dr. May Chapman was appointed Chief Nursing Officer yesterday. How do you see her appointment in addressing the current nursing shortage struggle in Canada?
I welcome the appointment. I think it's important to have a voice at the table that speaks to the specific concerns of nurses and the fact that we are faced with a nursing shortage in Canada, but that is not good enough. What we know is that nurses are overworked, they are under-resourced, and they are being burnt out. I met with nurses and the solutions are clear. We need to increase the hiring of more nurses. Nurses are having to work overtime, not take vacation, because there's simply not enough nurses to deal with the demands that people that we have in our healthcare system. So it's not good enough to just appoint someone to represent those concerns. We need action. And we know what that action is: properly hiring the appropriate number of nurses to deal with the needs and demands in our healthcare system, to make sure that they're paid a good wage, and to make sure they have the resources they need to do their jobs. I've spoken with so many nurses. These are people that love the work that they do. They care so deeply about their patients and they want to provide the best care possible. And they are heartbroken that they can't do that. But it is not their fault. They're working with the best they can, but they need more help. And what we need to do is provide the solutions. And that's making sure there's adequate number of nurses hired. And we laid out some of the paths to doing that, whether that's recognizing international training, that's speeding up the accelerating of the immigration process for internationally trained folks to be able to work in Canada, or hiring more long-term care workers to free up spaces in hospitals. But we need to act immediately. The solutions are there. It requires courage and leadership, and the principle of defending a public healthcare system that should be there for everyone.
En français, s'il vous plaît.
Donc, on invite cette position. C'est important d'avoir quelqu'un qui peut représenter les besoins ou les inquiétudes des infirmières, mais ce n'est pas suffisant comme solution, parce que les infirmières travaillent dur dans des situations tellement difficiles et ils veulent livrer le meilleur service possible, mais ils ne peuvent pas parce qu'ils n'ont pas les ressources nécessaires. Ils travaillent trop long, les heures trop longues, et ils n'ont pas les ressources nécessaires. Donc, ce qu'on doit faire, embaucher les infirmiers nécessaires pour répondre aux besoins. On doit s'assurer qu'ils ont des bons salaires et on doit les donner les outils nécessaires pour faire le travail. Ce sont les solutions. J'ai parlé avec les infirmiers et je sais qu'ils veulent livrer le meilleur service, mais ils ne peuvent pas à ce moment parce qu'ils n'ont pas les ressources nécessaires et on doit régler ce problème.
Any follow-up?
If there's no other questions, Mr. Singh, can you give me that response in Punjabi?
Yeah, I can do that for sure. Sure. I'll do the Chapman in Punjabi. Okay. At the end, we'll do it at the end then. Okay, sure. We'll go to Zoom then, Nina, if there's any questions on Zoom, and then we'll come back to Omni at the end. Thanks.
Sounds good. So we'll go ahead with Alex Belingo with the Toronto Star. Please go ahead.
Hi, Mr. Singh. Thank you so much for taking our questions from Zoom out here in Ottawa, zooming in.
Nice.
Just on a separate matter, I'm writing today about Conservative MP Michael Chong's proposing reforms that he says are necessary to improve the House of Commons. The basic premise, I guess, is that party leaders have too much power. Backbench MPs or individual MPs don't have enough. So I wanted to ask about that basic premise. What do you think of that? That party leaders are too powerful and that backbench MPs need more power in Parliament?
Well, what we're up against right now in Canada is really a question of priorities. We've seen from the Conservatives in the past pandemic, during the crisis of the cost of living going up, they've really been absent in responding to what people are going through. And that to me is the bigger problem, where we've got Conservatives that aren't responding to the needs of people, have been absent in really putting forward solutions, even though they're the official opposition. And we've got a Liberal government that has continued to side with the very powerful when push comes to shove. When we look at the inflation crisis that we're going through right now, and the comments being made by the Bank of Canada that's saying, don't give workers an increase in inflation. And we have a federal government that would rather point out that Canada is better off than other countries when it comes to inflation, rather than talk about how we can help people out. And the fact that a lot of the inflation that we're experiencing right now is being driven by corporate greed. We've got clear evidence that wealthy corporations are simply increasing their prices because they can. There's been incredible journalism that's pointing out that corporate grocery stores have increased their prices beyond their increased costs to make more profits and are posting record profits. And you can only post record profits if you've increased your prices beyond your increased costs. So we know that corporations are making record profits. The Liberals are not willing to do anything about that. They're not willing to stand up for people. And Conservatives are more interested in process and more interested in fighting each other, and really have been absent when Canadians have needed help. New Democrats have been really focused on what can we do to get people help. I think that's our priority. That's where I'm putting my effort, and my team is putting our effort. How can we get people help? How do we respond to the cost of living going up by giving people immediate support, financial support? How do we respond to the healthcare crisis by calling for solutions to fix our healthcare system? That's what we need to see happen in Ottawa, is a focus on people and what they're going through and the help that they need, and listening to what people are raising as concerns. And so that's what I think is more important than what's being proposed by Michael Chong.
I don't know if I got to follow up, I guess, but so on the specific idea, I guess I was hoping to hear you on this notion that over time power has become too concentrated in party leaders, and that erodes the core purpose of Parliament to act as a function of accountability on the government. Do you agree with that premise?
Where I would can focus my attention on in terms of where we can have a more effective and robust democracy is better representation of people's votes. So less the concern around the individual members of Parliament elected, but the fact that we've got an electoral system where someone can have far less than the majority of votes and have the majority of seats, where people vote and don't feel like their voice is being reflected in Parliament. And so to give people that voice, I think that the focus should be on things like reforming our democratic system to include proportional representation. So everyone who votes feels like their voice is being heard and is seeing the result of their vote. And that way we'd have a Parliament which would require more collaboration, would require parties working together. And that would actually give people more say, more voice, and make sure we don't have a scenario where one party gets a majority government and so much power without having the support of sufficient people to legitimize that power. I think that's really a big question. But I want to also mention that individual MPs play a very important role, and that role is something that should be recognized, and it is an important role that has to be executed by each individual member of Parliament. And we want to see each MP have the ability to hold the government to account, to raise questions, to be able to have access to information in order to hold the government to account. And those are things that we can certainly strengthen. And there's ways to ensure that MPs have the tools and ability to question government, to question decisions, and to be able to hold government to account.
Thank you very much. Now we'll go to Palak Manga with Parliament Today. Please go ahead.
Hi, Mr. Singh. Thanks for taking our questions.
Chris.
Just given some of the concerns that you're raising, and I guess the talk that we've seen over the last recent weeks at the very least, I'm curious what level of scrutiny you'll be giving the government's dental care plan in the fall. We know that so far details are limited, but I'd like you to walk us through essentially how you think talk of privatization factors into your calculus in September. Are there certain no-go zones that you're etching out right now, or is that something that's likely to be hammered out at the upcoming retreat in a couple of weeks?
Thank you. And the framework they're saying in the upcoming, I just missed the last part, in light of like our no-goes in light of the upcoming, and then I missed the last bit of what you said.
Yeah, I'm saying, are there certain no-go zones that you're communicating right now, or is that something that's going to be hammered out at the upcoming retreat? At the upcoming retreat,
got you. Yes. So yeah, there's certainly things that New Democrats are very firm on. We believe that our healthcare system should remain public, and the idea of allowing privatization to enter into our healthcare system is wrong. We've already seen it start, and we think that was a wrong decision, and so we are firmly opposed to that. We want to see a healthcare system that is really there for everybody. That it should not matter how much money you make, what's in your bank account. If you need care, you should be able to get the best quality care possible, and we know that is achievable. But it will take some courage. It'll take some leadership, and it'll take some priority setting. And that means making sure we properly fund our healthcare system, that we make sure that we've got the human resources, the staff necessary to respond to people, that we have frontline healthcare workers that are properly paid and supported so they can deliver that excellent care. That's something really important to us. And we have seen subtle signs of privatization, now a very open declaration. Doug Ford is traveling across the country trying to sell this idea that creative solutions, as he puts it, is about making sure that people pay to get care. And what that's going to do is certainly make a lot of people rich, but it's not going to mean better care for most Canadians. And it's not going to mean that people get the type of care that we want people to get, which is the highest quality care where they do not have to worry about how much they make, and it is there for people when they need it. That's what we want to defend, and that's something that's really important to me. In terms of the specific no-goes, we've laid those out in our agreement, and we've got very concrete details around when things have to be delivered. And if they're not delivered, then that's a clear indication that we can't continue to move forward in the agreement. And we're prepared to enforce that to the highest level that we can to make sure that we deliver for Canadians. Our goal has always been, what can we do to give help to people? And we knew that was going to be difficult. We know that working together is always hard. If we can make sure that people get help, then it's worth it. If people aren't getting the help they need, we're prepared to always pull our support. We're not looking for that. We're not looking for reasons to pull our support. We want to look to find ways to get people the help they need.
Oh, sorry.
Sorry.
Yeah, sorry, can I have a follow-up as well?
Yes, okay.
Yeah, so just one of the major factors that behind sort of this crisis that you're referencing is a labor crunch. And I know you referenced quicker immigration processing and recognition of credentials. We have Minister Fraser up soon giving an update about his department. What's your message to him? What do you think he needs to move on to address this that the government hasn't already promised to do in things like the budget, for example?
Well, the accelerated pathway for frontline healthcare workers is a simple fix that the federal government can do immediately. And I reference this, and I want to be very clear. I've met with a lot of nurses. There are significant numbers of nurses in specific, but many other healthcare workers who have international training, who have done the steps of getting qualified in Canada, are actually qualified now in Canada. But the only barrier to them working here in Canada is their immigration status. That cannot be. That should not be allowed to happen. We need to make sure that we accelerate the processing of applications for frontline healthcare workers so that they can get to work. They want to work, and we need them to work. And so let's speed that up. That's one thing that can be done immediately. And then the second piece is the recognition of international training and experience. That's going to take a little bit more work, but that is something we can absolutely do, working in coordination with provinces and territories. So that's another area that I would encourage the minister to work on. And in general, the immigration system is in a mess. We have heard from so many constituents that basic applications are not getting approved: visitor visa, work visa, spousal reunification, family applications, workers, work permits. There are so many areas of problem when it comes to the immigration system. And so I really encourage the minister to step up and fix these problems, because it is a mess right now and people aren't getting the adequate response time and service that they need.
Thank you very much. I will throw it back to On Location if there are any questions.
Yes, we can do that last one then.
Can you just give me the general statement in conjunction?
Sure. I'll look to you then. I'll look a little bit off camera.
Sure.
Yeah. ਅੱਜ ਆਪਾਂ ਸਿਹਤ ਸੇਵਾਵਾਂ ਦੀ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ, ਕਿਉਂਕਿ ਕਾਫੀ ਚਿਰ ਤੋਂ ਸਾਡੇ ਸਿਹਤ ਸੇਵਾਵਾਂ ਦੇ ਵਿੱਚ, ਸਾਡਾ ਢਾਂਚਾ ਦੇ ਵਿੱਚ ਬੜੇ ਮਸਲੇ ਆਏ ਹੋਏ ਨੇ, ਬੜੇ ਤਕਲੀਫ ਆਏ ਹੋਏ ਨੇ, ਤੇ ਸਾਨੂੰ ਕੀ ਸੁਣ ਰਿਹਾ ਲੋਕਾਂ ਤੋਂ ਤੇ ਸਿੱਧੇ ਹੈਲਥਕੇਅਰ ਵਰਕਰਸ ਤੋਂ ਕਿ ਸਾਡੇ ਢਾਂਚੇ ਦੇ ਵਿੱਚ ਬਹੁਤ ਹੀ ਗੰਭੀਰ ਮਸਲਾ ਹੈ, ਇੱਕ ਕ੍ਰਾਈਸਿਸ ਹੈ, ਤੇ ਉਹਦਾ ਹੱਲ ਕੀ ਆ? ਸਾਨੂੰ ਪਹਿਲਾਂ ਤਾਂ ਸਿਹਤ ਸੇਵਾਵਾਂ ਨੂੰ ਸਹੀ ਤਰੀਕੇ ਨਾਲ ਫਾਈਨੈਂਸ ਕਰਨਾ ਚਾਹੀਦਾ। ਆਪਾਂ ਮੰਨਦੇ ਹਾਂ, ਸਾਡੀ ਅਸੂਲ ਇਹ ਹੈ ਕਿ ਕੋਈ ਵੀ ਜਣਾ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ, ਉਹਨੂੰ ਸਭ ਤੋਂ ਵਧੀਆ ਸੇਵਾਵਾਂ ਮਿਲਣਾ ਹੀ ਚਾਹੀਦੇ, ਤੇ ਉਹਦੇ ਕੋਈ ਅਸਰ ਨਹੀਂ ਹੋਣਾ ਚਾਹੀਦਾ ਕਿ ਉਹਦੇ ਕੋਲ ਕਿੰਨੇ ਪੈਸੇ ਨੇ, ਉਹ ਕਿੰਨਾ ਕਮਾਉਂਦੇ ਨੇ। ਹਰੇਕ ਨਿਵਾਸੀ, ਹਰੇਕ ਕੈਨੇਡੀਅਨ, ਹਰੇਕ ਇੱਥੇ ਜਿਹੜੇ ਹੈਗਾ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ, ਉਹਨੂੰ ਵਧੀਆ ਤੋਂ ਵਧੀਆ ਸਿਹਤ ਸੇਵਾਵਾਂ ਮਿਲਣੀ ਚਾਹੀਦੇ। ਤੇ ਅੱਜ ਕੱਲ੍ਹ ਡਗ ਫੋਰਡ ਤੇ ਹੋਰ ਜਿਹੜੇ ਮੁੱਖ ਮੰਤਰੀ ਹੈਗੇ, ਪ੍ਰੀਮੀਅਰਸ, ਉਹ ਕਹਿ ਰਹੇ ਨੇ ਕਿ ਆਪਾਂ ਪ੍ਰਾਈਵੇਟਾਈਜ਼ ਕਰੀਏ, ਆਪਾਂ ਇਹੋ ਜਿਹਾ ਢਾਂਚਾ ਲੈ ਕੇ ਕਿ ਲੋਕੀ ਪੈਸੇ ਦੇ ਕੇ ਉਹਨੂੰ ਸਿਹਤ ਸੇਵਾਵਾਂ ਮਿਲਣ। ਆਪਾਂ ਇਸ ਗੱਲ ਦੇ ਖਿਲਾਫ ਹਾਂ। ਆਪਾਂ ਚਾਹੁੰਦੇ ਹਾਂ ਕਿ ਹਰੇਕ ਨੂੰ ਵਧੀਆ ਤੋਂ ਵਧੀਆ ਸੇਵਾਵਾਂ ਮਿਲੇ ਤੇ ਪੈਸੇ ਦੇ ਕੇ ਨਹੀਂ, ਸਾਡੇ ਪਬਲਿਕ ਢਾਂਚਾ ਦੇ ਵਿੱਚ ਹੋਵੇ। ਤੇ ਉਹਨੂੰ ਇਦਾਂ ਬਣਾਉਣ ਵਾਸਤੇ ਫੈਡਰਲ ਸਰਕਾਰ ਦੀ ਜ਼ਿੰਮੇਵਾਰੀ ਹੈ ਕਿ ਉਹ ਪੈਸੇ ਦੇਣ ਸਹੀ ਤਰੀਕੇ ਨਾਲ। ਤੇ ਹੁਣ ਤੱਕ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਉਹ ਮੁੱਖ ਮੰਤਰੀ ਨੂੰ ਨਹੀਂ ਮਿਲ ਰਿਹਾ, ਸਹੀ ਪੈਸੇ ਨਹੀਂ ਦੇ ਰਹੇ ਆਪਣਾ ਸਿਹਤ ਸੇਵਾਵਾਂ ਲਈ। ਤੇ ਆਪਾਂ ਉਹਨੂੰ ਕਹਿ ਰਹੇ ਹਾਂ ਕਿ ਸਹੀ ਪੈਸੇ ਦਿਓ, ਸਹੀ ਫੰਡਿੰਗ ਦਿਓ, ਤਾਂ ਕਿ ਆਪਣਾ ਸਿਹਤ ਸੇਵਾਵਾਂ ਨੂੰ ਆਪਾਂ ਜਾਰੀ ਰੱਖੀਏ, ਉਹਨੂੰ ਪ੍ਰੋਟੈਕਟ ਕਰੀਏ। ਤੇ ਆਪਾਂ 3 ਸਪੈਸੀਫਿਕ ਹੱਲ ਪੇਸ਼ ਕੀਤੇ। ਇੱਕ ਹੈਗਾ ਜੋ ਇੰਟਰਨੈਸ਼ਨਲ ਟ੍ਰੇਨਿੰਗ, ਜੋ ਲੋਕੀ ਪੜ੍ਹਾਈ ਕਰਦੇ ਨੇ ਹੋਰ ਦੇਸ਼ਾਂ 'ਚ, ਇੱਥੇ ਆ ਕੇ ਰੈਕਗਨਾਈਜ਼ ਕੀਤਾ ਜਾਵੇ। ਜਿਹੜੇ ਲੋਕ ਇੱਥੇ ਕੁਆਲੀਫਾਈਡ ਹੈਗੇ ਪਰ ਉਹਨਾਂ ਦੀ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕਰਕੇ ਕੰਮ ਨਹੀਂ ਕਰ ਸਕਦੇ, ਉਹਦੇ ਕੋਈ ਛੇਤੀ ਹੱਲ ਹੋਵੇ। ਤੇ ਅਖੀਰਲੀ ਗੱਲ ਇਹ ਸੀ ਕਿ ਸਾਡੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮ ਵਿੱਚ ਸਾਨੂੰ ਜ਼ਿਆਦਾ ਕੰਮ ਕਰਨ ਵਾਲੇ ਬੰਦੇ ਦੀ ਲੋੜ ਹੈ, ਤੇ ਉਹਨੂੰ ਹਾਇਰ ਕਰਕੇ ਆਪਾਂ ਜੋ ਹਸਪਤਾਲ ਦੇ ਵਿੱਚ ਪ੍ਰੈਸ਼ਰ ਪੈ ਰਿਹਾ ਉਹ ਆਪਾਂ ਘਟਾ ਸਕਦੇ ਹਾਂ। ਸੋ ਆਪਾਂ ਇਹ ਹੱਲ ਪੇਸ਼ ਕਰ ਰਹੇ ਹਾਂ ਤੇ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਨੂੰ ਆਪਾਂ ਸਿੱਧਾ ਕਹਿ ਰਹੇ ਹਾਂ ਕਿ ਆਪਣੇ ਸਿਹਤ ਸੇਵਾਵਾਂ ਨੂੰ ਸਹੀ ਤਰੀਕੇ ਨਾਲ ਫੰਡ ਕਰੋ ਤਾਂ ਕਿ ਲੋਕਾਂ ਲਈ ਇਹ ਸਿਹਤ ਸੇਵਾਵਾਂ ਹੋਣ।
Last question regarding Dr. Lee Chapman's appointment, how is that addressed the current nursing shortage?
ਸੋ ਨਰਸਿੰਗ ਦਾ ਬਹੁਤ ਜ਼ਿਆਦਾ ਸ਼ੋਰਟੇਜ ਹੈ ਤੇ ਉਹ ਰੀਸੈਂਟਲੀ ਹੁਣ ਉਹਨੇ ਇੱਕ ਅਪਾਇੰਟਮੈਂਟ ਕੀਤਾ ਜੋ ਨਰਸਿਸ ਦੀ ਗੱਲਾਂ ਕਰਨਗੇ, ਪਰ ਉਹ ਇੱਕ ਹੱਲ ਨਹੀਂ ਹੈਗਾ। ਉਹ ਚੰਗੀ ਗੱਲ ਹੈ ਕਿ ਉਹ ਨਰਸਿਸ ਦੇ ਜੋ ਸਮੱਸਿਆ ਅੱਗੇ ਪੇਸ਼ ਕਰਨਗੇ, ਮੁਰੇ ਰੱਖਣਗੇ, ਪਰ ਜਿਹੜਾ ਹੱਲ ਆ ਸਾਨੂੰ ਪਤਾ, ਸਾਨੂੰ ਜ਼ਿਆਦਾ ਨਰਸਿਸ ਨੂੰ ਹਾਇਰ ਕਰਨ ਦੀ ਲੋੜ ਹੈ। ਸਾਨੂੰ ਉਹਨੂੰ ਸਹੀ ਸਹੂਲਤਾਂ ਦੇਣੀ ਚਾਹੀਦੀ ਤਾਂ ਕਿ ਉਹ ਕੰਮ ਕਰ ਸਕਣ, ਤੇ ਉਹਨੂੰ ਸਹੀ ਤਨਖਾਹ ਵੀ ਮਿਲਣੀ ਚਾਹੀਦੀ ਤਾਂ ਕਿ ਉਹ ਉੱਥੇ ਇਸ ਸਿਹਤ ਸੇਵਾਵਾਂ ਦੇ ਵਿੱਚ, ਉਸ ਸੈਕਟਰ ਦੇ ਵਿੱਚ ਰਹਿਣ। ਸੋ ਇਹ ਸਾਡੇ ਕੋਲ ਸਾਨੂੰ ਪਤਾ ਕਿ ਹੱਲ ਹੈਗੇ, ਤੇ ਇਸ ਅਪਾਇੰਟਮੈਂਟ ਨਾਲ ਇਹ ਜਿਹੜਾ ਸਮੱਸਿਆ ਦਾ ਹੱਲ ਨਹੀਂ ਹੋਣਾ। ਹੱਲ ਕਿਵੇਂ ਹੋਣਾ? ਜੇ ਆਪਾਂ ਇੱਕ ਕਦਮ ਚੁੱਕੀਏ, ਸਾਡੇ ਸਿਹਤ ਸੇਵਾਵਾਂ ਨੂੰ ਸਹੀ ਤਰੀਕੇ ਨਾਲ ਫੰਡ ਕਰੀਏ ਤੇ ਜਿਹੜੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਆਪਾਂ ਨਰਸਿਸ ਨੂੰ ਹਾਇਰ ਕਰੀਏ।
Thank you, sir. Much appreciated.
Thank you.
Family doctors.
Yes.
The shortage of family doctors across this country. It's always been emergency rooms for.
Yeah.
Are your solutions to that the same as the nursing shortage?
Yeah, in general, what we're seeing, and it's absolutely a real issue, people cannot get access to a family doctor, and good access to family doctor can absolutely prevent people ending up in emergency rooms. We've got good family care, family doctor access. It prevents illnesses from getting serious. It prevents people from getting to the point where they need to go to an emergency room, and it is absolutely a part of the solution. And the solution for family doctors is very similar to healthcare workers in general. There are incredible internationally trained workers in Canada that don't have their qualification recognized. We need to speed up the acceptance or recognition of that international training. We need to make sure that people are getting immigration status that are healthcare workers. And we also need to fund our healthcare system appropriately. And simply funding it at the right level will ensure that all the areas of concern can be addressed. But family care is a fundamental element of making sure our healthcare system works appropriately, because it can provide the care that will keep people healthy and so they don't end up in an emergency or acute care situation.
So I see no more questions. I would like to thank everyone. This concludes our press conference. Je ne vois plus de questions. Alors, ceci conclut notre conférence de presse. Merci.
Thanks so much. Thank you all. I'm working on it. I'm